Hello, I'm Dr. Kevin Sadati, facial plastic surgeon in Newport Beach, California, specializing in facial rejuvenation using local anesthesia and twilight sedation. Many of my patients ask me, Doctor, what is the downtime for my facelift? I explain to my patient that there are three different types of downtime or recovery. The first one is social recovery. The second one is physical recovery, and the third one is the healing recovery. And each one of these recoveries have immediate, intermediate, and long-term recovery. So I start with social recovery. So the immediate social recovery is going to be about 5 days, meaning you're going to be bounded at home, taking care of your incisions, and letting the bruising to go away before day number 5, that you can step out of the house, go for a walk in the neighborhood. So you start the intermediate recovery. At day number 7, you can drive yourself to our office and remove the sutures, and thereafter you enter the long-term recovery. So at that point everything looks good. So if you put your hair down and walk around this neighborhood or go back to work, nobody would know what you had done, just except you received some comments that you look refreshed or lost some weight, what a great vacation you had, that kind of thing. So, and however, if you want to go to a wedding or you have a big reunion coming up, I would say give it 4 weeks before the complete initial swelling and bruising and tight feeling to go away, so you feel good about it. The second recovery is called the physical recovery, meaning when can I start walking, when can I start run, when can I do weightlifting, and when can I do my swimming, golf, and tennis. So immediately, the immediate recovery from facelift in terms of physical is just walking around the house. The first 3 days are going to be very quiet time in terms of physical activity because we don't want any bleeding nor bruising. After that, you can, day number 4 or 5, you can walk around the neighborhood, so that increases your activity level. And after a week, when we remove the suture, you can do 3-4 miles of walking around the neighborhood. And when it comes to tennis, golf, and yoga, Pilates, I would normally say 5 weeks. But in between, you can do some Stairmasters or elliptical to get yourself busy. Swimming takes about 8 weeks because constant movement of neck causes stretching the tissue that we tighten under the skin, the muscle, so we don't want to rip that. So swimming is the one that you're going to get into last. The third phase of recovery is healing recovery. So healing recovery is where the incisions start disappearing. So after a week, we remove the sutures. That's a very immediate healing recovery. Most of the bruising and signs of surgery are gone by then for most people. Then the healing continues. We have very detailed post-operative care for incision lines. So in about 3 weeks, the incision line on front of the ear, which is behind the ear and here, will be gone. The incisions behind the ear for face and neck lift will disappear about a month, month and a half. So those are the long-term healing. And also there's some numbness and tightness involved, that those are more of long-term recovery. So after a week, everything looks good, you look good, so everybody sees you, it appears that you lost some weight or you change your hair and you refresh, but you don't feel it yet. So psychologically, because of the tightness and numbness that you feel inside, you don't see it yet, but your husband or your wife will notice that there's a significant improvement and youthfulness in your face. I'm Dr. Kevin Sadati. If you would like to have a consultation to understand if you're a good candidate for facial rejuvenation using local anesthesia and twilight sedation, please contact our office. I'll be happy to have a detailed conversation and see if you're a good candidate. Thank you.